Voice आ रही है ना? You can hear me. YouTube live. Yeah, no. Okay. What else? Apart from dental caries and oral cancer, bleeding gums, right? That is gum problems. What is the most common reason for tooth loss? Old age. No, I will say age is not a reason for tooth loss. Then what is the most common reason? Again, trauma is not the reason for most common reason for tooth loss. See, that's what I am trying to tell. We as healthcare practitioners, if we don't know what are the reasons for tooth loss, then we have some issues, right? The most common reason for tooth loss is gum problems. Tooth are held in the socket by alveolar bone, right? That you know it. So if the alveolar bone starts coming down because of the gum diseases, obviously the support is lost and the tooth will exfoliate, it will fall down. So that is the most common reason for tooth loss, that is gum problems. And how does it start? How does gum problem starts? Poor oral hygiene, exactly. So what needs to be done to preserve your gum health? Brush properly, right? So that is the answer to most of the things. If you know how to brush properly, 90 to 95% of the oral diseases, including dental caries and periodontal disease, that is the gum problems, can easily be prevented. But the sad part is, forget about the layman, the healthcare professionals also don't know how to brush. As much as 95% of the disease can be prevented, but we don't know how to brush. Can anyone tell me how to brush? How do we brush? Tell, it's okay. Tell whatever you know, tell it. How do you brush? See, you're not able to. Left, right, up, down, what? Zigzag, what motion? What motion do you use? Left, right, up, down, both. Anything else anyone does apart from that? Left, right, upright? Anything else anyone does? See, if you don't know how to brush properly, then how do you brush? What do you do in the morning? Just move the toothbrush all around the teeth. See, that is the reason why actually gum problems, bleeding gums, and the tooth exfoliation starts not from maybe 50, 60 years of age, maybe between this age only, or maybe as early as 12 and 13 years. Because we don't know how to brush. These are chronic diseases, just like diabetes mellitus, hypertension, periodontitis is also a chronic disease, caries is also a chronic disease. It takes time to build up. The gum disease starts at a very early age. If you are not brushing properly, bleeding gums will initiate, then the bone loss will start, and by the time you develop, think that already tooth mobility has developed and food is getting accumulated between the teeth, right? Those symptoms start coming in because we are not brushing properly. I'll tell you the method of brushing. Please try to follow it. At a 45 degrees angulation, hold the toothbrush at a 45 degrees angulation, keep it on the 3 teeth at a time. 90 to 95% of the bristles should be on the tooth surface, that's fine, but at least 2 to 5% of the bristles should go within the gingival sulcus, that is between the tooth and the gingival crevice, right? 45 degrees angulation, covering 3 teeth at a time. Place it in such a manner so that 90 to 95% of the teeth are on the tooth surface, bristles, and 2 to 5% bristles at least are within the gingival crevice. Once you have placed it like that, then you do 15 to 20 times horizontal movements, right? 15 to 20 times horizontal movements, and then one vertical stroke downwards. This is how you brush your teeth. You are engaging the gingiva, right? You are engaging the gingiva. And if we don't engage the gingiva, what happens? If we don't engage the gingiva, what happens? Then you will be brushing your tooth like just like you do your shoe polish, right? Scrubbing the teeth. You're just scrubbing the teeth. Might be you will prevent caries, but the most common reason for tooth loss is still there, and you will definitely develop gum problems later because you have never cleansed your gingiva, right? And the most common reason for tooth loss is not dental caries, but periodontal disease. So please, if someone asks how to brush, this is the technique how you used to brush for adults at least about 12 years of age. And once you have finished cleaning 3 teeth, then move to the next 3 teeth and next 3 teeth. In the lower dentition, keep it at a 45 degrees angulation towards the lower margin. Method will be same. Is the technique clear? This is what has to be followed. Your toothbrush should be changed in how many years? Every 6 months? Every 5 years? When should we change a toothbrush? 3 months. Change your toothbrush every 3 months irrespective of whatever has happened. However, if the bristles have frayed, bristles मुड़ गए हैं, तो उसको पहले भी change कर सकते हैं. Change it earlier, right? Don't keep them for years. What type of bristles you will use? Soft to medium bristles are there. Soft bristles are for periodontally patients who have gum problems, but otherwise medium bristles can be used. Texture of the bristles. Hard bristles are used for cleaning washrooms and toilets, so please, I don't think so it's available also. Don't ask for hard bristles. What about toothpaste? These are the basic things, right? How do you brush your teeth? What toothpaste do you use? What toothpaste do you use? Colgate. What do you use? Anyone who uses apart from Colgate anything else? Can't hear. Pepsodent. Sensodyne. Why do you use Sensodyne? Why do you use Sensodyne? Don't know. Exactly. You are using a dentifrice. Toothpastes are nothing but dentifrices. They help in cleansing your teeth. The most important thing is the brushing action. But dentifrice also helps in brushing, cleansing mechanism. So what type of toothpaste we use depends on our needs. What our needs are there. Generally, if someone asks, we recommend a fluoride toothpaste. That is fluoridated toothpaste. Why? You have read all this. At least for your entrance, you must have read all this. Why do you use fluoride toothpaste? Why do we use a fluoride toothpaste? Fluoride makes the enamel more resistant, more stronger, right? Normal tooth structure is what? Tooth is made up of what? It is hydroxyapatite, right? Enamel is hydroxyapatite. When fluoride acts on it, when you use a fluoride toothpaste, it forms fluorohydroxyapatite, which is more resistant to dental decay, or you can say it makes the tooth more stronger, right? That is why we use fluoridated toothpaste. Whenever you ask for a toothpaste, irrespective of brand, you can ask for a fluoridated toothpaste. Brand doesn't matter here. But patients who are having sensitivity, then they ask for what type of toothpaste? But blindly we should not be again prescribing Sensodyne or similar toothpaste, because sensitivity can be because of many reasons. Sensitivity can be because of dental caries. You have incipient carious lesion, small carious lesion is there, and that develops into a sensitivity. So by using a Sensodyne toothpaste, the sensitivity will go or not? How it will go? You have to get it restored, right? You have to get the caries removed and get the tooth restored. Sensitivity toothpaste will not do anything, right? If you have periodontal problems, bleeding gums, bone loss has initiated, bone loss has initiated, food is getting lodged between the teeth, pockets have formed, you have again sensitivity problems throughout the mouth. So will that sensitivity be resolved by using these toothpaste? Again, no. So it will not be useful in this case also. Only thing is, when it will be useful is when the enamel structure is abraded. Abraded means disappears. ज़्यादा ताकत लगा के घिस दिया आपने दांत, वो enamel हट गया. Once the enamel has been abraded, the dentine gets exposed. And dentines are nothing but dentinal tubules. They have their one endings in the pulp, where the nerve endings are there. So whatever stimulus is there gets transmitted directly, hot or cold, whatever you take, directly to the pulp. You getting it? So that sensitivity which comes is because of the dentinal tubules, which is getting, the stimulus is getting transmitted directly to the pulp, to the nerve endings. So to block that, we use those sensitivity toothpaste. So the dentinal tubules which are there open, it just seals them off. Right? So when you have abraded teeth structure, only then use this toothpaste, otherwise they will be of no use. Did it make sense? No. It makes sense, right? Once you have a abraded tooth structure, only then use a sensitivity toothpaste, otherwise it will be of no use. Any other toothpaste someone else uses? Apart from this, for children, please do not advise. Children below 3 years, do not advise the fluoridated toothpaste. Below 6 years, 500 parts per million, and for adults, it's 1000 to 1500 ppm. It comes in that range only. In endemic fluorosis areas, where there is higher level of fluoride in the water content, please do not advise fluoridated toothpaste. Right? What about other toothpaste, Patanjali or anything else? Anyone uses it? Are you using it? Should we use it or not? Should we use? You're using it, tell, there's no harm. Anyone else is using it? So what is the problem with these toothpastes? Why should we avoid them? No, fluoridated is not a necessity. It makes the tooth structure resistance stronger. But yes, okay, if it does not have fluoride, but something else it must be having. But why should we avoid them? See, if you use them, patients come with saying that the bleeding problem has stopped immediately. The gums are feeling more tightened, better. Then why we say that still we should avoid this? The contents of the toothpaste, because of the high metal contents, the astringent action is there. So bleeding will stop immediately because of the astringent action. But what it causes is also a severe abrasion of the dentition. Severe abrasion. You use it for 3 to 4 years, 5 years, the entire dentition will become half. The entire enamel will get abraded. So we have seen thousands of patients whose entire dentition have abraded if they have used it over a period of 5 to 6 years. So that is one of the reasons. That's why we say please avoid these toothpaste, and they have been banned in entirely European Union and in most of the states in US also. Then toothpaste, I have told you what to be used, when to be used. Toothbrushing, I have told you. So if you follow it properly, most of the diseases can be prevented, right? How many of you use oral rinses, mouthwashes? You are using? Anyone else? You are using? What mouthwash you use? Listerine. No, something else you are telling. Colgate. Colgate means there is chlorhexidine in that? You don't know. You are using it, but Listerine. Anyone else? See, we have come across patients who are being prescribed by healthcare professionals mouthwashes containing chlorhexidine, and they are being used as for months. Some even have used it for years. These are drugs, right? Chlorhexidine is a drug. In 0.12%, it's a bacteriostatic drug. At 0.2%, it's bactericidal. It is not supposed to be used for more than 10 days. Maximum 10 to 15 days. That is the duration for which chlorhexidine mouthwashes should be prescribed. But most of the healthcare professionals, even the specialists, you come across the prescriptions and it's written 1 month, 3 months, 6 months, use as whenever it was possible. So this is not how you give a prescription. These are drugs, right? So it should not be prescribed for more than 10 to 15 days. Otherwise, there will be a major problems which will be creating for the patients. So what type of mouthwashes, if you want to use, you can use warm saline rinses, right, on a daily basis, or any other mouthwash which can be used on a daily basis, just like Listerine or any other similar mouthwashes. But any mouthwash containing chlorhexidine, check your mouthwash, whatever you are using. Colgate, you told. If you are using it on a daily basis, then you are taking medicine on a daily basis. What are the timings of using a mouthwash? When do you use a mouthwash? What is the best time to use a mouthwash? After meals? After breakfast, after lunch, after dinner, after each meal? After dinner. Before sleeping, that is the best time, and after breakfast, right? After breakfast and before sleeping, these are the two best times when the mouthwashes should be used. Why? Why this time? Why do you prescribe it only after breakfast or only after before sleeping? What some reason should be there, right? It cannot be just like whatever we are saying just because of no reasons. Some rationale should be behind it. See, the effect will last, right? If you are taking it prior to sleeping, you had your dinner, obviously, when you rinse, the effect of the mouthwash will last because you're not going to eat anything after that. So the effect will last for a longer period if you take it after dinner prior to sleeping. And same thing is for breakfast. Once you had your breakfast, you rinse your mouth, everything is done. You rinse your mouth with a mouthwash, and then the effect will last for at least 2-3 hours. Right? So that is the reason why we give this timing. Now, is it clear? Mouthwashes, toothbrushing, and the dentifrices to be used. These are the basic things, and that will prevent majority of the diseases. The sad part is we don't practice the prevention part. Otherwise, everything can be prevented with this, if you only we brush properly. Anything you want to ask regarding this toothbrushing, toothpaste, or in mouthwashes? What is the significance of primary dentition? You know, there is the primary dentition and permanent dentition. That much you know it, right? We have not spoken about malocclusion, right? Caries, periodontal disease, malocclusion, and cancer. These are the public health problems from a dental perspective. So malocclusion is what? What is malocclusion? Malocclusion means some problem is there, abnormality is there in the occlusion, right? That's it. The occlusion is not in a normal position. So how does it develop? The most common reason for a malocclusion for an Indian child is what? Then we start paying so much money and the child goes through trauma of getting all the braces placed for 2-3 years, treatments will be there, teeth will be extracted, and so many things will be there. How that can be prevented? Can that be prevented? In most cases, yes. For the Indian population, yes, it can be prevented, because why these malocclusions are developing is we think that the primary dentition is Not so significant. Primary dentition तो important है ही नहीं, दूध का दांत है, गिर जाएगा फिर से permanent आएगा. So what happens is, once you have a primary dentition, you allow the tooth to exfoliate or fall down or get it extracted, and you do not replace it. Then what happens? These teeth have a tendency for mesial migration. Any vacant space is there, the teeth will move mesially. So that space will be closed. So suppose a canine or a premolar, upper canine, upper premolar, lower canine, lower premolar, they are supposed to erupt at an age of around 12, 11 to 12. And your primary teeth, which was extracted at the age of 6 or 7, so 5 years time period is there for the tooth to erupt. And if you do not get it replaced, the tooth, because of the tendency of mesial migration, will close that space. Once the space is closed, at the age of 12 or 13, when the permanent dentition is coming, erupting, there is no space for the tooth to erupt. So that is why they come out labially, lingually, or from all sides. Because the primary dentition, the space which was there for that tooth, has been taken by some other tooth. Because we did not preserve that space. So primary dentition is as important as the permanent dentition. Develop that concept. Don't continue with the false beliefs, whatever we have. Primary dentition is as important as the permanent dentition, and if we preserve the primary dentition properly, only then the permanent dentition will erupt in a specified space, right? In some cases, yes, malocclusion will develop because of genetic causes, because of skeletal malocclusion. That is a different thing, but most of the cases of malocclusion can easily be prevented if we just preserve the primary dentition, right? All these are very simple things. Only thing is we do not practice. The sad part is we do not practice prevention. What about oral cancer and precancerous lesion? Again, it's the same thing. What is precancerous lesions or oral cancer? Does it develop? What is the etiology behind it? Okay, it appears as whitish plaque, but what is the etiology? What is the reason? Tobacco. What is the reason for developing cancers or precancerous lesions? Mostly 90% of cases, it's tobacco, right? So, if the reason is tobacco, it can easily be prevented. This is a behavioral modification, right? It's a lifestyle factor. You can easily choose not to use tobacco, and in 90% of the cases, obviously, again, it can be prevented. 10% cases it develops without even using it, and the chance factor, the genetic things and other things are there. But at least among the 90% of the people, it can be prevented. That is why such kind of cancers are much more common in the Indian subcontinent, India, Sri Lanka, Pakistan, Bangladesh, as compared to the developed economies. Because there the level of awareness is much more as compared to what we have. And basically the availability and use of these tobacco products. The most common cancer for Indian population is oral cancer, right? At least 50 to 70% of the cancers are oral cancers. You go to developed economies, hardly 3% of the cancers will also not be oral cancers, right? So these are basically can be easily prevented, can be modified. Why? How can be modified? Lifestyle changes, right? And precancerous lesions can, what are precancerous lesions? Oral cancer, everyone knows. You develop a full-blown cancer in the oral cavity. What are precancerous lesions? Yeah, but what are they? They are red and white lesions which have what? Higher tendency or higher chances of transforming into a cancer, right? So you have leukoplakia, you have erythroplakia, you have oral submucous fibrosis, you have many more lesions which can transform into a oral cancer. So I'm not going into the depth of it, how do you treat it and how do you don't treat it, but most of the cases of precancerous lesions will not transform into a cancer. So if such kind of patients come to you with red and white lesions with a history of tobacco use, you keep them under your watch. Don't just tell them directly go for a biopsy. until a lesion is, ulceration is there, fixation is there, right? A big nodule is formed. Those are different things. Most of the cases of leukoplakia, erythroplakia, patients will just complain of inability to take spicy food, or some ulcerations will be there, small ulcerations, white lesions will be there. So you need to just keep them in your follow-up. Advise the patient to quit the habit. How do you advise the patient to quit the habit actually? Most of the patients know that it's harmful. I don't think so there will be a single patient, even whether it's educated or not educated, by looking at the label, at the box or the BD pack, they will know that it is harmful, but they are consuming it. So how do you ask them to quit now? What you will say? This causes cancer. कैसे करोगे काउंसलिंग? क्या करोगे? काउंसलिंग में तो ये कहोगे ना कि कैंसर होता है इससे तंबाकू खाने से. उनको पता है. Exactly. Basically, if you try to tell this will harm you, this will cause cancer, and this is, they know everything. कोई नहीं छोड़ने वाला. But the moment you try to extrapolate that fear to the next level, you will have cancer and other things. That is a different issue. But because of you, your family will suffer, your children will suffer, your family, everyone will suffer, taking you to the hospital and spending whatever savings are there, and try to just extrapolate that fear to the next level. That is the time when the patients actually start thinking. Otherwise, if you tell him that this causes cancer, then everyone knows it. No new addition is being added. How well you extrapolate that fear, how well you manage that fear, that will decide whether the patient will quit or not quit. So that is up to us. How well we give our health education. Again, I'll come back to caries once more, and then maybe 15-20 minutes I'll just take a fun session. What is caries? What is dental caries? होता क्या है caries? It's a chronic disease, right? That much you know. It's a progressive, irreversible microbiological disease affecting the hard tissues and the soft tissues of the oral cavity. Microbiological है मतलब bacteria is involved. Hard tissues क्या होती है oral cavity में? What are the hard tissues of the oral cavity? Enamel, dentine. What are the soft tissues of the oral cavity? Soft tissues of the oral cavity, pulp. Gums में caries नहीं लगती, tooth में लगती है ना. So it is pulp. So if the hard tissues are involved, enamel and dentine, if enamel is involved, what you can do? Get it restored. If dentine is involved, get it restored. But if the pulp is also involved, the dentine involvement which progresses till the pulp, then you cannot get it restored. Then you will have to get a root canal treatment done, right? If a dentine is involved beyond the pulp or up to the pulp, then you will have to go for a root canal treatment. So this is a chronic disease. In some forms it can be acute, like in radiation caries, rampant caries. What are radiation caries? Patients who are undergoing radiation for some treatment, if the teeth are there, the teeth become brittle and the caries develops very fast. So for them, radiation caries is the acute form, and rampant caries is what? What is a rampant caries? Rampant caries are also called nursing bottle caries, and that happens generally because of the habit of using those small kids will be there using the bottles. Parents will give them as pacifiers to the children. They will be using it, just holding it and sleeping with the bottle. So there is a continuous exposure of sucrose, sugar to the child's teeth, right? Child will be pacified, he will not cry. But the continuous exposure, what it causes is immediately all the teeth will be affected with caries, and it will be very fast progression. It's in an acute form. Chronic progression is slow. Acute progression will be very fast, and within no time the child, all the dentition will be lost and black root stumps will be seen. And basically that is very expensive to be treated. and the child will have to go to under a general anesthesia, under a GA, then they have to perform all the root canal treatments for all the teeth. It's very painful for the child. So again, it can be easily prevented by not adopting to such habits. Please do not give a bottle to a child and make him sleep with the bottle. Before the child goes to sleep, clean the gum patch and the teeth, either with a brush or with a hand or finger or cloth, anything, but clean it. And whenever you are placed, wherever, in whichever place you are working, if the Anganwadi workers or the workers who are there in your domain, if you are working in a government sector, please try to train this to the workers who are there going to the fields, Anganwadi workers and other workers, so that they can also spread this message to clean the gum pads clean. Otherwise, again, it's a very simple thing, can be easily prevented, but so many patients are coming with this kind of caries, which is also called nursing bottle caries, rampant caries. Right? This is the acute form of caries. So all these, whatever I have spoken about, everything can be prevented. Only thing is we are not following prevention. Any questions still here? No. Don't have any doubts. Who all uses gel toothpaste? Close up. Close up. Someone told ना, someone uses close up. हाँ? उसको कह रहा है तुम लोग एक ही टूथब्रश करते हो, हैं? एक ही पेस्ट को अब तक खत्म. What could be the harm of using toothpaste which are translucent? You can see through and through them. You can see the light passing through them. I'm not saying don't use them, but who should avoid them? Who should avoid them? Those toothpaste have silica in them. Silica is abrasive content. It's abrasive material. So people who are already having sensitivity, people with again dental fluorosis should avoid using toothpaste such as, I will not give a brand name, but any toothpaste with a light passing through it, means translucent toothpaste. Avoid using them if you have sensitivity problems or if you have a weak dentition. I'll very briefly talk about the health promotion. This has already been covered, I think so. It has been taken in your CFM sessions. It has been covered, right? So I'll not go in depth, but still, since it is common to all, whether it's dental or medical, I don't care. Basically, health promotion, health education, I'll be covering. If we get time, I'll try to cover fluoridation and defluoridation. What is happening here? What is happening here? Leave it. What's your name? Shreyas. Suppose Shreyas has gone. Okay. I pronounce it. It is a proper noun. I can pronounce it. Whatever we have. But anyways, suppose he goes for vacation to a hill station, to a Shimla or some other place, sitting next to a stream, and he sees someone is drowning and asking for help. So we assume that he knows swimming, and he jumps inside, pulls him out, saves one life. The moment he comes out, he again hears two people shouting for help. He again jumps inside, gets both of them out. Like that, it continues. So he saves around 5-10 lives. Right? After that, he is tired. He was resting for 5 minutes, around 20-30 people went down the river, drowned. It's okay. He was tired. Again, he helped few people out, maybe 2-3 people he saved. Again, around 50-60 people just drowned like that. So, the people who drowned, the people who passed away, whose mistake was that? It was his mistake. He was not a good swimmer. He should have given in more efforts, put in more efforts and saved each and every one of them. So what went wrong here? The number of people with the disease, the number of people with the problem, who are what they are facing is so high that he alone will not be able to manage it. Right? Instead of being in this place where he was just seeing people drowning, and he was trying to help them just by jumping inside. Had he been here, he could have prevented the people from jumping inside the river, right? Had he been there at an upstream level rather than at a downstream level, he could have saved many more lives as compared to being there where he was. So the same principle applies to healthcare. We need more of interventions. We need more investments at an upstream level rather than at a downstream level. You understanding the concept behind it? The downstream level and the upstream level. What happens? At an upstream level, you can prevent the disease from developing. You can prevent the people from jumping inside the stream. At a downstream level, what you are doing is you are just trying to save them. You are trying to save them, and you don't know how many people you will be able to save and how many people you will not be able to save. Right? So at AIMS, what are we doing? What are we doing? AIMS is a tertiary care hospital, right? So tertiary care hospitals, what we do, our main, we are doing primary care also. It's not that we are not doing primary care, but the most important thing, the reason behind these institutions being built was they are tertiary care institutions providing specialist treatment. So will the number of AIMS or will the number of these institutes have a effect on the